My name is Weston. I'm currently 18 and I am from Big Timber, Montana. I was actually born here in the hospital in St. V's.
Right after birth, the nurse heard a murmur and she said, you know, this is common with babies. A lot of them have murmurs, so, you know, his was a little louder than normal.
A lot of my life I was told that I wouldn't really have to have anything done. Maybe when I was 50 or 60, I would have to have a minor surgical intervention, maybe a valve replacement or something of that nature.
My expectation was that it was just going to be a quick, easy visit, because that's the way that bicuspid aortic valve visits usually are. You do some surveillance, the valve is, you know, they work pretty well for a really long time in the vast majority of kids. Weston's valve, it was leaking, we would call it severely.
And all the while we've been told, hey, valve replacement, catheter type valve replacement, no big deal. And then when Dr. Big goes, no, this would be open heart. And it's like a ton of bricks fell on us.
Being 17 at the time and about to start one of the busiest years of a high school student's life, it was a little hard to hear, and it was definitely a tough conversation to have. I kind of had a lump in my throat and was kind of like, oh my goodness, most of the time.
If it hadn't been for this team monitoring it and paying attention to it and knowing what to watch for and what to do, we would have never potentially known he even had a problem. And that could have led to a total disaster.
Weston ended up having what we call a Ross operation. So your heart has two outflows, one that goes to your lungs, one that goes to your body. And so because the valve that went to Weston's body was failing or had failed him, we had to replace it with a competent valve.
He would tell Brian and I, what are you guys worried about? I'm in great hands, I'm fine. And before he went into surgery, he looked at us and did a thumbs up.
Well, obviously he had a lot of confidence in everybody, and so do we. So.
I actually plan on going to MSU this fall, where I'll be majoring in animal science on a pre-veterinary track. About the end of my junior year, I had really discovered that I want to pursue a degree in veterinary medicine. Ever since I was young, I had always had an interest in animals and the health sciences, whether that's in a clinic, in a hospital, whether I open my own practice. Can definitely use all those skills to make myself a well-rounded individual that can hopefully impact others as much as they've impacted me.
When you go out into the community and you see a kid, if you can't tell that they have a congenital heart disease, that means that we're doing our job. When you look at Weston, he's doing all the things that anybody, well, more than what most people would be able to accomplish, but I mean, he's doing everything as if he doesn't even have congenital heart disease. And to me, that's the most validating part of my job.
So Rylee is 12. She is our bookworm that loves to ski. She's also a dancer.
Dear St. Vincent's Health Foundation, hi, my name is Rylee Jansen and I am 11 years old. I was involved in a car accident around 4 months ago where I fractured my skull.
She was out biking and hanging out with friends. She was offered to go to a friend's house for dinner, and the path that led her there meant crossing Rimrock.
It was really sunny, like that weird golden hour, so I couldn't really see what was going on. And my friend was a little bit more ahead of me. And then I heard a honk, and it was just golden, and all I saw was the bright sun.
They found that she had fractured her skull, and then it was pushing in on her brain, and then it was the options of, all right, do we have surgery or do we not have surgery? So they guided us through those options, and then consoling Rylee through that process was challenging, because you have a girl, that's preteen with beautiful long hair and not wanting to have your head shaved, because that's the worst case scenario that's going through your mind.
When I found out I was gonna have to get head surgery, she ended up braiding my hair so not my whole head had to get shaved, or the whole left side of my hair. and it was a perfect amount of braiding, and she French braided it, and my mom can't French braid, neither can I, so I don't really get to get French braided. While I was at St. Vincent's Hospital healing, I got to feel what it was like in a patient's shoes and see what it was like to be a doctor. My passion for becoming a doctor and wanting to help kids my age grew even more because of that experience. I would love to volunteer and help at the hospital, but unfortunately I don't hit the age mark to volunteer. So I was wondering if there was anything I could do to help kids at St. Vincent's Hospital and be in the workspace of doctors.
We love seeing old patients here. It's one of the best things about my job is knowing that most of the patients I take care of, they're gonna get better and they're gonna thrive out in the world. And so to see them come back in here feeling happy and healthy, it's just wonderful for us, because then we know that, you know, we were able to help them in that time of need so they could get back to that life that they're living.
We just don't do enough, but yeah, just we appreciate what you're doing, not only for Rylee, but for everybody else that you see on a daily basis, and can't imagine what they go through, not only to physically treat somebody, but the emotions that go through and trying to comfort somebody, but also being able to do your job and keep your emotions in check. There's, yeah, how do you even, you have to be a special person to do that. And we realize that and acknowledge that, and I don't think doctors and nurses get recognized enough for that, because you're special people.